Welcome, and thank you for joining us for part 2 of the Converting Big Data into Actionable Results series, titled Gaining Knowledge. During this webinar, we will discuss predictive analytics, knowing what we know, how we can do a better job of looking into the crystal ball and projecting what will happen tomorrow. In order to keep background noise to a minimum, everyone will be muted. We encourage your questions at any time throughout the demonstration. Just type your question into the chat box and we will answer any questions at the end of the session. Our presenter today will be Todd Featherling. Todd is a trailblazer in the field of healthcare technology and data analysis. Now he is working with YourCareUniverse to bring the first cloud-based real-time patient analytics solution to life. Todd, do you want to go ahead and take it from here?
Yes, so excited to be with everyone today, and look forward to going through this session with everyone. I will remind you before we get started that we'll be taking questions at the end, so you can send those via your chat function on your window, and those will come to Lauren. She will take those and provide those back to us at the end of the session as well. So be thinking about questions along the way. We're going to move pretty quickly like we did 2 weeks ago and go through this process as quickly as possible. So what we are doing is a 3-part series. 2 weeks ago we talked about data and tools, and just to remind and refresh everyone, when we went through that session we spent a lot of time talking about structured data versus semi-structured data versus unstructured data. How do you deal with different forms of data? What, as an analytical person, should you be thinking about? Where do you capture data? What data sources are available to you? We went through all of that. We also went through a couple of tools, specifically around how do you visualize data in this new world that we're living in? What databases, new databases are available to you, both from, and when I talk about databases, I actually talk more about how to transform data into something as opposed to a Medicare database that they might have available or for sale. And then what types of statistics might be important. And we spent just a fraction of our time last time on that area. We're going to spend a lot more time this week discussing that. Part 2 is really about gaining knowledge, and what I mean by that is going through the analytical process and planning framework for analytics. So when we talk about analytics as a framework today in our world, it is really about descriptive analytics. These are what a lot of individuals did, for the last 20 years of preparing basic statistics. So give me a count of the number of patients that we had who had DRG 291, heart failure and shock. I want to see how many of those patients were of this age, this demographic, those types of things. And my favorite, or probably least favorite really, is the use of zip codes in healthcare. So zip codes have absolutely zero impact on how patients get to hospitals and or community health. It's merely a way to get our mail to us. There really are much better levels of geography to look at. The problem is it causes most analytical staff additional work to translate a list of zip codes by patients into something more useful like block group or census tract, or even specific addresses if that level of specificity is available to the analyst. The next area of the planning framework is in predictive analytics. We're going to spend some time talking about that today as well. In the area of predictive analytics, this is where we are starting to use these models that we've built based off of descriptive statistics. So what variables are the highest correlated? Which variables have some causation associated with those variables, how much of that causation can be predicted, and how much can be impacted. So we're going to spend a little bit more time about talking about that. In addition, there's been a sort of new term that I think has hit the analytic community over the last 2 years Others have been using it in various forms and fashions way before that. But the area of prescriptive analytics, and what prescriptive analytics to me is intervention. So you have a model that you've built, the data is flowing in, and you take a corrective action up against that data model. And then the outcome of that data model should change, assuming you took a positive or even a negative prescriptive change. So we're going to talk a little bit about what that looks like and where you might be wanting to spend more time in the future to make adjustments for that. So the third component or last component will be action, and our final three-part series of this webinar will be going from data analytics to action, and we'll spend the last session talking about how you go about either through strategic planning or work groups to actually implement change based on analytics. So hopefully that's good and everybody's on board with that. The promise of analytics, as Lauren mentioned in her introduction, analytics today is about finding the crystal ball. Tell me how my community is going to look, how my patients are going to look. Tell me everything about what is going on. And by the way, I want it real time. I want to know what happened yesterday that's going to impact today. That is where I think we as an industry are all driving towards. Obviously, if you talk to a lot of analysts throughout the country, no one probably is there yet. There are several success cases early on that in particular areas of the healthcare system we're starting to make progress in this area, but this is really what we've focused a lot of our time at YourCareUniverse with the group there to get to real-time patient analytics, so that as soon as anybody comes in through any clinical front door that's being tracked and measured, the CCD, the continuity of care document, would come through and be processed, and we would know at that point where they are in the care pathway. And so this crystal ball is very important because inside of the crystal ball is everything going on in the environment. What's the weather temperature today? What is the air quality today? What's the water quality of what I'm consuming? Do my patients have adequate access to healthy foods? Are there food deserts in my community? Are there infrastructure issues? Do people have access to primary care clinics? For indigent populations in particular, is there a health disparity? Are we seeing higher or lower birth infant mortality in particular neighborhoods in our community? So those are the things that from a more holistic perspective, people want to have available to them today through their analytical engine, because each one of those variables impacts the downstream. So by downstream, you could probably put yourselves in one or two boxes today. Providers are still very much incentivized to drive volume of care and drive revenue. So one of the things we want to know are what things are going to lead to higher volumes. So you might have an entire model focused on volume metrics, and then you might have a secondary model that's focused on cost containment, which would include keeping patients healthier in a well state. It might include how do we keep them out of different care centers. So how do we redirect care before it comes into an emergency room into a primary care center or into an urgent care center? Where else could we impact the cost of that care throughout the whole continuum? And by whole continuum, I mean post-acute as well. So whether or not that person receives home health, they go to a hospice location, they go to a SNF location, how do we leverage all of the assets in our community? The only way to get to that point is through analytics and having this real-time data flow that is coming together. And that should give you the crystal ball for your community or market. So I'm going to bring you back to the data-driven strategic planning slide here that we talked about last time as well. This is a model that I built that I'm working on a book for right now. And what we're doing is bringing together a couple of concepts. So one would be the traditional strategic planning modes of looking at our SWOT profile, our core mission, vision, internal, external forces, and all of that is really that data layer that we talked about last session. So this session, we're more interested in how do we turn that data into information and knowledge, and the third session will focus a lot more on wisdom. So in this session about the information knowledge and really how to assess what's going on, we're taking that data and we're beginning the transformation of that data into something more meaningful so that it can start to inform benchmarks, other metrics that we should be looking at, what we call a market opportunity analysis. So as I look across my crystal ball and I look not only at my operating performance information that's coming from my business intelligence system, but I'm also looking across the entire market to see how much of patient volume has leaked out to other providers or even outside and left my community altogether. And we begin to put dollars and information together so that we would know what strategies we could pursue in order to capture either more volume, or as I said, if you're in the value-based world, how do we direct care to the right location in order to maximize our payments, whether it's keeping people out of the hospitals or sending them to an alternative care location. Ultimately, that will inform your insights, and then at that point, you're really at a decision mode. There is always a hourglass sort of situation where we bring all of this data and information into the top level of the hourglass, and we have to make a decision right there at the midpoint. And then we can expand that back out and actually go out and execute up against that strategy. So hopefully today we can get you to that decision point as far as how you go through each one of these steps as you continue to either evolve or create revolutionary strategy. As far as analytics planning, as we said, these are the 3 different steps that we're going to begin to discuss today. And where I always begin is writing things out. We had a great example of this last Friday in our own offices here, where we all got together around a whiteboard and began to figure out where the data was coming from, take that into analytics and figure out what could we do to transform the data to make more meaningful sense. At the same time, what ancillary data needs to be brought into the process in order to make a better informed decision. And so what we do is take these very complex algorithms and begin with pretty simple statements to develop the algorithm so that then that becomes the hypothesis of what we're testing later on in the analytics. All of the most difficult, complex algorithms started off simple, and as soon as we begin to let other people interact with that algorithm, they obviously get a lot more complex. So let's think today in terms of both analytics that are available to us, but even beyond analytics. And I'm going to introduce a new term, if you would, called omnimics. And this is a sort of state of knowing all. And that's really where I think, from a crystal ball perspective, that we're trying to get. And I stole this a little bit from my friends at the Vanderbilt Bioinformatics group and how much they've educated myself on phenomics and this measure of phenomes and how the interaction within that can begin to cause genetic mutation and other environmental influences and that study. So as I start to think about analytics being concerned with the same synthesis of all available data, not just organizational data, because I think a lot of times in the study of analytics, especially analysts that work for a given hospital system, or even community health department, a lot of times we get too focused on just our own individual data and not all of the data that would be available to us. So we put that into a whole new mental construct, begin to assimilate in new information, accommodate our thinking into that existing knowledge, and hopefully that creates this new mental schema to be all-knowing. I promise if you stick with us and come back for the third session of this webinar series, I will have a graphic depicted for this new study here soon. So knowledge is power. First of all, we have to be data aware of the information that we have available to us and the other additional information that's available through third parties. We need to interact that with business intelligence. I really do separate analytics from business intelligence. For me, business intelligence is about, in a very important study, but it was about capturing the organizational activity and making that available to our business people to make more efficient, effective decisions going forward. Analytics for me is about taking the organizational data and then merging that with all the other available data around the world into our process that helps inform what else is going on. Else, you're looking at purely being in a silo of information, and the decisions that you make and changes that you make may not have an impact because in the model it wasn't accounted for any external environmental factors that could be at work. Last but not least is also data enhancements. So appending data and information onto existing data sets, but also transforming that data. So we're going to speak in a little while about some statistical modeling that you might want to consider. But as that data comes through the model, the resulting output might be a new user risk profile that needs to be appended back to every single piece of data in your database. And that's what I mean by data enhancement, that it can also come from secondary data sources. So from geocoding and appending latitude and longitude to appending psychographic profiles, demographic profiles, the environmental data, all of the different ways that you can actually make your data more valuable to the organization and improve the overall value proposition of analytics. Last, turning that knowledge then into wisdom and helping executives make more informed decisions. So like I said, that's a new term that we think can become really important to describing what's beyond analytics. So the data, as we begin to move this webinar into talking about more of the statistical processes that are going on and the things that you might want to work with in your data and analytics. One thing we didn't cover that I got a question about last time via email after the last webinar was to talk a little bit about how do we convert data into more structured, meaningful information. So if any of you have been out there and you've run statistical analysis and tried to do some of this work, you're probably familiar with this concept, but there's a very last stage that I take anytime right before I begin running analytics, and that is to go through that data set and figure out how I can create count and structure that data in a way that will be more meaningful to the statistical analysis. I'll give you one quick anecdote that you guys can go up and look up on the web if you want to at your free time. We created an index probably 8 years ago called the So Healthy Index, which was a comparative index of all 50 states. And the way that we were able to do that is we had probably 2,500 variables that were available to us. And this particular index tracked and measured the actual health outcomes up against health education. So within our research work that we did in Vanderbilt University here in Nashville, Dr. Bruce Gohl was very gracious in helping us work through our statistical models and validate our assumptions that we had made. We were able to pretty accurately predict that if we can do health education at 9th and 10th grade, we can actually reverse some of the negative healthcare trends that were going on in the country at the time. Fast increasing rates of diabetes, obesity rate, smoking, drug abuse, other types of mental and behavioral health were all impacted by 9th and 10th grade health being taught. So that's sort of the last chance that you get for teenagers where they will still listen to teenagers, and they're also still in the formative growth structure years from an anatomical perspective. So very important finding, and it would not have been possible if we didn't take that last step and structure the data and do counts, because once we started running our correlation and regression analysis, either A, we probably would not have had enough processing capabilities at that point. That's sort of predating all of our Hadoop and MapReduce sort of days. So might not have even had enough processing capability to do that. But in going through that extra step, we actually learned a little bit more about the data, and it changed our hypothesis slightly. So we were able to take that last step. When we start talking about data variables and move into the statistical world here as well, it's sort of important to know what types of data and variables that you're looking at. Are these quantitative types of data and information from either surveys or other components that have come out? Are they ordered data that can be measured? A lot of times as well, if it's possible in the statistical world, we'll take, sort of categorical or text-based information and convert it into an ordered data set so that we can see whether or not there are positive or negative correlations that might exist. Sorry about that. Log out of that real quick. The next area that we would take a look at would be algorithmic development. In this particular case, what we are looking at, there's a great poem out there. I know you guys weren't expecting poetry today on the analytics call, but Rudyard Kipling, The Elephant Child, is where I got this from. There's probably a lot of other different philosophers who have come out with this. But I always start thinking about who, what, when, where, why, and how, and create that into a math statement. So the elements of an algorithm, from my perspective, go through purpose, value, what the metadata that might be associated with this algorithm. Are there other elements that we should be thinking about and looking for? What is the selection criteria of where we're actually going to go and fill this data and information from? What alert mechanisms should I be thinking about? If I come up with a really important finding, how am I going to let somebody know about that, especially if it's a algorithm that's going to run out on its own up against in the data set? Are there any exclusionary components that I need to be aware of? Patient values, are those coming into the algorithm? In which case, as soon as I know there's any patient identifiable information, I need to think differently about this whole process. Where is it going to be housed? What are the security parameters that are going to be around it? And then the last step that we always go through is codification. So how do I go about looking at this information and take it into a code set that is replicable to any organization, particularly around YourCareUniverse, where we're working with 340 plus hospitals. It's very important that there be some standards-based criteria on the algorithm that we're building and that we're looking at. It may not be as important to be this regimented when you're looking at algorithmic development from a single hospital perspective, but certainly if you're in a larger system or if you're in a looking across an entire community, that becomes very important. From there, we take the algorithm, we draft it, we test it by actually running some queries up against and see if, in fact, we're getting the desired outcomes of the data that we're looking for, and then finalize it and commit it to a code set. So from a statistic perspective, and we talked a little bit about this on tools the last time we were together, from an open source perspective, R is certainly one of those areas that has gained a lot of attention and is a excellent tool to use, and you can be up and running fairly quickly on this particular tool. There's also some very good MOOC courses that are out there that are online courses which you can subscribe to through a Coursera or somebody like that if you need to get up and running in this particular area. SPSS is a tool that I've used quite a bit over the last 15, 20 years. It's very easy to use interface, very powerful engine, and it's really good, I think, at ingesting data in a lot of different formats. So sometimes we even use that for our data cleaning, data scrubbing process as well. For those of you that are going to be taking down large government data sets, SAS is a great alternative. Medicare, CMS, HHS have all begun to put their data, even the economic data that's coming out now, is already in a SAS format. So even if you're an SPSS shop, we can talk to you and try to help you understand there's some ways that you can take that SAS data and actually run it in through the SPSS import script and use it as well. But those are sort of the three big tools that we use today and are most familiar. There are hundreds of other tools that are out there, and would love, for you guys to post any other tools, comments up on statistical software that you're using today to get to the results that you're looking for. The first area is, as we talked about, it's really correlation. Always the first step so that we can go through the data and see from a visual perspective, but also a statistical perspective, which variables have the highest correlation. This is a graphic that I pulled from the EPA site that kind of shows 3 different data sets and how they are all either highly correlated, not correlated at all, or going in the negative direction, or the third one on the right shows in a positive direction. So these are, excellent ways to integrate this information into your presentation. It also helps your management team begin to understand and learn from a statistical perspective what types of information is important to look at and which information is not important. So the So Healthy Index, we started with 2,500 variables, as I mentioned before. That got culled down to a couple of hundred variables that were really important to us. And at the end, I think we were down to 10 or 11 total variables that predicted most of the outcome. And so that ability to have the discipline to go through these steps is extremely important from the analytical process. Next area obviously would be regression. So once we have culled those variables down to focus in on what's most important, then the analysts would need to begin to look at different types of regression based on the type of data that they're looking for, whether it's linear, logistic, or lasso. It's really about finding those causal relationships between the variables and then going through the steps to determine which of those variables might contribute to the movement. And I always look at, both positive and negative, obviously, because a lot of times you might find that lower income would have a increasing impact, for instance, on utilization, or you might find the exact opposite. We have found historically in some of our research that high urban areas look a lot like high rural areas. and that might seem to be a quandary in your mind, but from a healthcare expenditure perspective, that is what we have found, and it really sort of demystifies some of the thoughts that people have about what's driving the overall cost equation in their communities. Where we find the highest utilization and dollars being spent, it's really in that suburban ring around many urban centers. And so once again, through the data and information that you're able to present about healthcare services, you can help bust some of those myths that your management team may have about where they're spending their both dollars and resources to either drive volume or drive more wellness. The next area we do is start to begin to estimate what the model parameters might be, build out those model parameters, and then do a fit into the regression model and start to begin to look at variances and predict how much of each one of these variables or components would accurately predict the outcome in a future state. So Luke Wiley on our team, our data scientist, spends a lot of time going through this process, and we do this for a couple of reasons. As I said before, one of it is to reduce the noise. So if I know there are only 6 components to a particular model, and I've gone through the analysis and I've gotten to that point, that's a much better place to be than if you have 300 or 400 different variables that have some small, slight impact in the overall model. So one of the things that you want to do is test different models up against your data set to see if, in fact, you can use a different regression model that might have a higher predictive on the outcome side, which is often the case. It does take a little bit more time. Sorry about that. It does take a little bit more time to go through those components and to test and retest, but we think it pays a pretty good dividend going through that process. All right. In the predictive modeling world, the next things that you might begin to dig deeper into and begin to understand more would be sort of the Bayesian theories, and in particular the different probabilities that you might be able to generate out of that type of model that begin to help us understand what a future state might look like going forward. Another area that we've found a lot of success with is around random forest analysis. This is a great way to have a test or a training data set and then begin to run multiple iterations on that training data set to see, in fact, how good the model is. Are we coming up with the same output consistently month over month, quarter over quarter? And if so, we can let that model continue. If the model begins to deteriorate or find less success over the future periods, then it may need to go back through those steps that we just mentioned and reapply either new variables or begin to ask other questions of the analytics as far as what could be driving the outcome. Maybe we've been focused on access as the dominant factor, but in fact it's really payer status that is driving the outcome, or some independent variable that we didn't have any access to, i.e. who the originating primary care physician was, that might have impact downstream on a COPD analysis. The last area that I wanted to mention briefly is around cluster analysis. This is one of the areas that's probably most fascinating to me as I begin to understand how do we go and begin to improve our community's health status. I was at a great presentation this morning that's occurring here in Nashville around Healthy Nashville with Senator Frisk. And there, what I think we're going to get to a state is beginning to look at neighborhood clusters and how the delivery of healthcare, the cost of healthcare, and the outcome of healthcare can be affected. So truly getting to a prescriptive state, and would also love any feedback that the audience might have on areas that have worked in your community. Obviously, when we start talking about best practices, from my perspective, a lot of that work, might take 5 to 8 years to do the research. It's another 2 to 3 years to get it peer reviewed. And so you might be a decade away from having one of these really important findings. However, as analysts, we might see these types of relationships, i.e. the cluster analysis and the grouping, that are really beginning to occur in our local communities today, and then try to figure out how do we go forward and use that information to impact a larger piece of the community. As I mentioned before, we're going to be taking some questions here, so feel free to put those up into your chat window, and we'll get to those at the end of our presentation here. The last area I wanted to spend a little bit of time, this is an area I've been exposed to more recently over the last 2 to 3 years, but one that I think holds a tremendous amount of promise in the world of healthcare analytics, and that is machine language learning, pattern recognition, being able to go through 30 million records and figure out everyone who has DRG 291, heart failure and shock. 5 years earlier, they were at a pre-diabetic state, and they had a certain lab value of X, Y, and Z. And then 5 years later, those always turned into a heart attack. So those are the things that I think, sometimes go beyond what the human mind can actually go in and begin to search. But with machine language learning, we start to begin to put these hypotheses down that we see in the initial data set, and then let that artificial intelligence sort of take over and begin to figure out in either an unsupervised learning methodology, meaning that we're going to let the machine just continuously grow, learn, spit out things that it begins to see in the data itself, versus some supervised learning where we start to seed it with components that we feel like are highly correlated or have some predictive value into what could be learned from this particular data set. So this is an area, once again, there's some great courses out if you want to go deeper into this area, especially as it relates to either community health, tremendous amount of work going on in the community health, public health space right now from both infectious diseases, but also from how to provide primary care to a larger piece of the population. And there's also a lot of work in this space right now going back to the previous session on unstructured data, of taking very large physician note databases and beginning to use this data to make more sense out of those physician notes, and even create a codified or structured format out of unstructured data. So the future of this area is quite exciting for me, and one that I hope we can all begin to work on together as a larger community. So quick summary of what all we've talked about today as far as going from that data to information knowledge perspective, and how do we go about gaining that knowledge from the different analytical framework perspectives and planning to the statistics and modeling processes that you'd want to apply against a lot of the health databases and health data sets. Part 3 is November 16th, 2015, here in a couple of weeks at 1 p.m. Central Standard Time as well. In this particular session, the last piece of the 3-part webinar series, we will spend more time talking about creating effective strategies around health data and analytics. How do we implement learning systems on top of all of the analytics that we've been discussing? And then in particular, what does the ROI look like for analytics today? How do you go about measuring that? And we'll introduce a model at that point as well for return on investment. So what I'd like to do at this point is to open up the questions and see if we have any questions from the audience line.
Thanks, Todd. That was very informative. We have had a couple of questions come in. The first one is, how do I get my hands around the data available to me and what it can help me predict?
So that's a really great question. In fact, I was just on a phone call about an hour ago with a organization out of Colorado that's a primary care group, and that's exactly what we were doing. Is we were talking about every point of care and where the information is coming in and what they have access to and what they don't have access to. And there's a great exercise to go through called a mind map that I would highly recommend for the person who asked the question to put a big piece of poster paper up on the wall or get a big whiteboard and begin to think about this from a transactional perspective. So the other term that I've used in the past is called a care wheel. So literally, if I go from a well state to some type of pre-acute, urgent, emergent care setting to acute care to then post-acute and back to a well state, what are all of the elements, either content, commerce, or transactions that are going on there, or connectivity that would come into play when a patient or a future patient begins to transact with the system. The other thing that we spent some time thinking about recently is in a new world of value-based payments, bundle payments, some of that, certainly in the Medicare world, there's going to be data that's going to be tracked. But there might be a lot of transactions that I'll call off the book that are going to occur. And these are now discount insurance cards, programs run by Cigna and other people that I go in and I pay for cash based on a predefined set of services that I'm willing to pay for. The other area is concierge medicine these days. This tends to be an area that we have a lot more cash payments, so there may not be that claim that's ever generated and run back through the system. So great question, great way to be thinking. As I said, I think the best thing to do is start with a mind map and follow the money because that'll tell you where there is data available today and then where there might be a future state where you don't have that same level of data available or even more data, depending on what types of community you're working with, organization.
Great, that was very helpful. The next question is, how can I teach and train my executive management team on the value of this level of analysis and statistics?
Well, that's a great question. When we had the first webinar, I talked a little bit around this particular answer in that most CEOs today want the answer. So they're not quite sure how to ask the right questions, but they want the answer and they want to get there as soon as possible. And we as analysts and people who are in the analytical world have to do a better job of telling stories and educating management teams on how to go through that story. It is really a step-by-step progression to go from an idea to capturing data, to formatting that data, to beginning to run the statistical process, and then to create the outcome of what that data set is going to tell us. And eventually, if we're lucky and we find a hypothesis that we're able to prove, then we can turn on a model and begin to use this information. So a couple of pitfalls that I see in training management teams to use statistical analysis and analytics are that it's a process that doesn't always end in a positive outcome. You may spend a month chasing down an algorithm or a hypothesis that you have, and it fails. and that's okay. What you want to try to do is to get to that answer through some preliminary investigation as quickly as possible, but management teams need to know that this is a process and something that's going to have long-term future impact on the organization. So it's absolutely worth it from an investment perspective. And as I mentioned, we will spend some time at the next one on an actual ROI model so that you can begin to quantify what the value of analytics would be to your organization. If I'm able to save 3% cost, that's probably a really good thing. If I can drive 15% more volume, organizations, CEOs are going to be excited about that every day.
Great, thank you. It seems like we don't have any more questions. We thank you for your time today, and we hope you'll be able to join us on Monday, November 16th at 1 p.m. Central for Part 3 in the Converting Big Data to Actionable Results series titled Using Answers for Action. This last session will focus on how to use descriptive, predictive, and prescriptive analytics to craft an effective strategy and impact the bottom line. Please send any questions about this presentation to info@YourCareUniverse.com, and we will send out the recording of today's webinar by the end of the week. Thank you so much for your time.